Hi guys, welcome to the Genius People video series where we're going to start conversation with leaders in healthcare, biotech, life science, and as well global health to see how together we can democratize health. Stay tuned. Manny, how are you?
Great, yourself?
Good.
Good to see you.
Perfect. I'm really happy to have you here because you have a journey to share with our friends.
Sure, thanks for having me.
You started as a physician, surgeon, now you're a global health leader. You've been working in the pharma industry for many years, writing books, been everywhere. So I want you to share the story not only because of you, but probably as well to inspire others and tell them that, a lot of things are possible, especially if you have the vision. So tell us about you and then we discuss the next step of your life right now.
Sure. So I'm from Cameroon. You probably know that, right? Raised by my grandmother in Cameroon, and she sold tomatoes on the side of the road for a living, and successful my parents through school, and eventually we ended up in the U.S. right? And I studied medicine, and I actually started off in surgery, and then got into cardiovascular medicine, right? That's my area of interest, and I've worked in clinical practice, worked in industry, like pharmaceutical industry, in research, worked in from the private equity side to the venture side, back into pharma as well, and other startups I've worked in, and now I'm trying to pursue the new direction in my life.
So that's funny because you say the new direction is the future, right? And then you wrote a book about the future of healthcare. So tell us maybe the three things, because it's a long book, I started to read it, really passionate. What is the three things you think would be the future of healthcare and that shouldn't be denied right now?
Correct. So the first thing is something that I think we both share similar interest in, which is the idea of technology being able to democratize healthcare, which means it basically opens up access to anyone in the world, just like people today on Facebook could connect with anyone in the world, right? So I think technologies like telemedicine, for example, allows people to connect with people, with physicians from America could talk to patients in Cameroon or in Congo, wherever they are. It's irrelevant where you are located in the world. So that's one. Two is this idea of predictive medicine and preventing disease, right? So today, what we basically do is we'll wait to get sick and then we go to see a doctor. I see a future in which with technology today, where we're all connected to devices and other things, that we could actually be more engaged in our health, we could be more proactive in medicine, and we could actually live longer, healthier lives if we actually do that, right? Third is this access piece of like drug supply things, for example, right? If you go down to low-income countries, for example, it's very hard to figure out if the drug is actually real or not. I think blockchain, for example, in drug supply, could actually make sure that the consumer believes the drug that they're actually taking came from the original manufacturing source, right? So I think those three areas are pretty big areas of interest for me.
And I recall a conversation we had when I was in Africa. We were on the phone together, and then you said, I want to be in the field. That's what you said.
Right.
Why?
Why? Because I think to make change, you have to be where the need is, right? Sitting in a corporate office and sitting in front of my computer, I can only read what I think is happening, right? So being in the field, you get to engage with people. It brings back the idea of being back in medicine, right? I'm talking to patients. It's like every other business, right? You want to talk to your customers to understand exactly what the needs are, right? I cannot sit in New York and make assumptions about what is happening in Rwanda or what's happening in Congo, in Nigeria, right? I need to be on the ground. And I think just being on the ground, some of the basic things that we can do just from basic health screening, right, can go a very long way. And I think that's more rewarding, and that's the whole reason why I went to medical school in the first place, right? So it's being there and impacting lives. And if it involves making the right investments to support people to make change, I'm all interested for that.
You said as well something, we need to tell the story, because sometimes the story is not being told. Do you know why it's not being told, or what kind of story should be told about the culture, about the way people live, the way they take care of their health, or the way the system is built? Maybe there is something you want to say about it.
Sure. I mean, you've spent a lot of time in Africa, right? And so you know Africa pretty well. I think the African story is always told from a different point of view, right? It's never told from the African point of view. And if you look at specifically around healthcare, right? I've been in places in Africa where They had patients with dialysis and they have no dialysis machines, like something as basic as that, right? Things we take for granted in the West. The idea of preventive medicine doesn't exist in many places, right? But interestingly, people have a traditional form of medicine that people still practice, right? Which come from herbs, and whether they work or not, there's no science to support that, right? It doesn't mean it doesn't work, but there's no infrastructure in most places to actually say, hey, if you take this leaf, does it work? Or, if I eat this papaya tree thing, does it work or not, right? So there's no way to actually tell. So there's no research infrastructure, and because of that, all that knowledge is being lost, right? And we depend on other people to bring knowledge in. So I think that's another unique angle to tell. Two, Africa has a huge community kind of spirit, right? So if you're sick, for example, where in the West everyone is busy going to work, it's difficult to have caregivers. In Africa, you have a much bigger social support, right? Whether people are related to you or not, people tend to care about your health in general. So there's more of a community support kind of things that happen, which the West could learn from as well, right? If we have the right models in place to show the impact of such things, maybe we could transfer such things back to the West, right? And then take things that are good from the West and back to Africa, right?
And do you think this is why right now we see a lot of focus or interest on social determinant of health? Do you think it's the same thing, social determinant of health here in the US and culture in other part of the world? Is that something, or culture, environment, and the lifestyle? Do you think you relate those two?
Yes, which is very interesting. It's a very complicated mix, right? So here in the U.S., for example, I always use a great example of like St. Louis, Missouri, right? With the Delma Boulevard, for example, is a street in St. Louis that splits the city up into two parts. Basically, the northern part of this line is all wealthy, and the southern part is poor. The rates of diabetes and cancer are significantly higher in the poorer part of the city than in the richer part of the city. That already tells you there's something different, right? It's the same city split around one particular street. The same thing about St. Louis could apply in Baltimore, it could apply in the state, it could apply in country level, and it applies also in the global level, right? So it's not just St. Louis as an example, but that's a great example to look at. So the same thing happens in Africa. But the interesting piece is, in Africa, meanwhile, the poor person has a local garden in their backyard where they probably grow your own tomatoes and your own celery and eat your own local food, which is actually organic. The wealthy people in Africa are actually probably eating more junk food, right? Like canned foods, processed foods, because it's a different way of looking at health, right? And the same thing applies in places like China, for example, right? Where the rates of diabetes in China in 1980 were about 0.67%. In 2011, it was up to 9-point-something%, right? So what happened? The genes did not change over time, right? So lifestyle changed. So it's a very interesting way to look at it. So it's not necessarily the fact that poverty leads to you eating junk, like happens in the West a lot of times, right? But is that socioeconomic determinants of health could be either way, where you're wealthy and you eat junk, or you're poor and eat like very healthy foods in a place like Africa or other developing countries where people can afford foods from grocery stores, so they actually eat pure foods, right? Which is very different from the West. So it's very interesting on things that we could learn from each other and how we could structure healthcare.
Now, what is as well really interesting is when you talk about social impact or impact investing, whatever we use as a term, is we often think about what is the company, what is the solution, technology we're going to invest in to have a broader reach, right? Save more lives, etc. We less think about how we can conserve certain habits of culture, of how we can communicate with the population. Regarding raising awareness on the danger of nutrition, for instance, of the local diet, the importance of local diet. So do you think this communication part can be part as well of the impact investment, where this is not a technology, this is not a biotechnology, but it can be just a media platform where you inform, and we see that a lot with patient engagement, which is a portal of information, right? So can we translate that in terms of going broader than just developing technologies, but developing a process of education? And do you think there is an interest in a future for that?
Correct. Actually, I think health literacy is like the biggest thing that could be the biggest cost driver in Africa, right, or in developing countries. Even in the US, even if you go to poorer parts of the country, in rural areas, I think educating the consumer or the patient is a very important strategy. For example, my grandmother never went to school, right? My grandmother had diabetes and hypertension. She knew she took drugs, but she had no idea what the drugs did, right? She lived in Washington, D.C. for some time, but when she goes to the doctor tells her, eat a healthy diet, so eat some veggies, eat asparagus, eat broccoli. That's not part of an African diet, right? It doesn't relate, it doesn't translate, right?
Steamed broccoli, no, they don't eat that.
Exactly. So in Cameroon, it's not part of our diet, like cheating grub, those kind of things, right? So how do you personalize a diet to someone, right? So the idea of that I will eat, just green beans and asparagus and fit in different kind of meals without taking into consent that I have a certain taste that appeals to me is completely different. And I think that probably is one of the big reasons why people don't actually adhere to diets, right? And so I think the idea of personalizing the right diets, not creating an artificial diet that people cannot relate to. Right? We talk to them about, hey, if you like to eat, like dried beef, for example, or you want to eat cow skin, this is the right portion of cow skin you should eat, right? It's more personable for the person than saying, if you eat fried rice or if you eat this, when that's not part of your diet, right? It becomes like they have to make an extra effort to get access to this diet that is not real.
So it's more about now the proposal, right? The intervention, not saying don't eat this, but more this is what can be offered to you according to your culture and to your organism.
Yes, I think the future of society today is about personalized, right? So if you watch Netflix, your movies are personalized, right? If you go on Google, your searches are personalized to you.
Everything is personalized except that of healthcare. Right?
Instead of healthcare, correct. And if you look, yes, correct. If you look at Google, for example, Google will personalize ads to you, and I'm not picking on Google, but any platform, Amazon, everyone else personalizes things to you. They recommend things to you based on your likes. But in healthcare, we just sit around and just watch, like everything go through, right? So I think it's a different way of thinking, and I think we have to look at healthcare in a more proactive manner, not as sick care, but as healthcare that's just part of life, right? It's not something that you get up one day to start engaging in healthcare, right? Healthcare is life.
So, I mean, we have always great discussion, ideas, and vision. Tell us, what is your next bold action, so we can, share that with our friends here.
Sure. My next bold action is to take you and the film crew on a trip, right, across the world. I personally think a lot of innovation comes globally around the world. A couple of weeks ago, I was in Mexico City, for example, had discussions with other innovators in healthcare, right? The professionals that were down in Mexico, and we know the same thing happens in Rwanda, right? Or it happens in Congo and different parts of the world, or in France. I think my ideal vision would be to bring some thought leaders together, and we go on a trip and have discussions, maybe over marshmallows, or over corn, and or fireside chat.
Broccoli? No.
No
broccoli.
In this
Okay,
case,
perfect.
right?
Let's make the suitcase. Let's pack. Let's go.
Do it, right? So I think that's the next big thing that we need to do, and I think to tell that story, right? I think the story is very important. You have to tell it. So,
thank you, Manny. That's great. Let's do it. We're going to make it.
We'll make it happen.
Take care. Thank you so much again.